Hi, today we're going to be giving a sub-Q injection. So one of the first things that you want to do is you want to verify your doctor's orders. So today he's ordered 5,000 units of heparin. Unfortunately, all we have on hand is 10,000 units per ml. So all we're going to withdraw from the medication vial is 0.5 mLs. The next thing that you want to do is you want to check and make sure that your patient doesn't have any allergies to this medication. Then you're going to go ahead and gather your supplies and wash your hands. And you also want to make sure that you do the 6 rights of medication administration: right patient, right drug, right dose, right time, route, and documentation. So for sub-Q injections, you can use the needle sizes, or the needle gauge sizes you can use is 23, 25, and 26. And the syringe sizes you can use is either 1 mLs or 3 mLs. Today I'm going to be using a 1 ml syringe and a 25 gauge needle with a length of 5/8. Also the lengths are 3/8, 1/2, and 5/8. So the first thing that you're going to want to do before you withdraw the medication is you're going to want to check and verify that medication 3 times. So the first time you're going to do it is when you withdraw it from the Pyxis machine. Make sure that it's the right one that the doctor ordered. Then you're going to do it while you're preparing it, and then another time at bedside. You're also going to want to check that your medication is not expired. So the next thing that we're going to go ahead and do is prep our medication. You're going to clean the top off with a alcohol swab. You're going to go ahead and inject 5 mLs of air into your vial. And when you are withdrawing the medication, you want to make sure that there are no bubbles. You are going to go ahead and recap the needle. You're going to switch out the needle. And I'm going to go ahead and show you. This is 5 mLs. And in the case of heparin, you always want to make sure that you verify the dose with another nurse because it is such a high-risk medication. So the next thing that you're going to do is you're going to label and transport your medication. You're going to label it with, in this case, you would label it with 5.5 mLs of heparin. And also, whenever you're transporting it, if your medication does have an antidote, and in this case it does, you're going to want to bring that as well. The antidote is protamine sulfate. So once you get into the room, you're going to go ahead and wash your hands, put on your gloves. You're going to want to explain the procedure to your patient. So you're going to be letting them know that you're going to give them heparin because heparin is an anticoagulant. So the reason why you're giving them this anticoagulant is because you don't want them to develop any type of blood clots while in the hospital. The next thing you're going to do is you're going to verify that they don't have any allergies again. You're going to check their wristband, check for any allergy wristbands. Then you are going to verify that it is your patient with 2 patient identifiers. The first being their name, the second being their date of birth. And in this case, you can do a focused assessment. So what you're going to check is the lab values. You're going to check the platelet count. If it's too low, you're not going to want to give heparin because it could cause them to potentially bleed out. And now all of the sites for the sub-Q injections is the back of the arm, the abdomen, the upper outer thigh, the upper buttocks, and the flank. So now what we're going to do is go ahead and prep the patient for the medication. You're going to clean off their skin. You want to rub for about 30 seconds. Let that completely dry. Then you are going to pinch up the fat about 1 inch, and you are going to you're going to distribute, or you're going to give them the medication with a dart light motion at either a 45 to 90 degree angle. You are going to want to give them the medication slowly. And you don't want to massage, and you are going to dispose of your shrubs. And that is how you give a sub-Q injection.